Hello everyone, welcome to my channel. I am Siddhi Bhattare and today's my topic for discussion is on vildagliptin. So in this video, we will first will see that what is actually vildagliptin, for what action it is used. Like, our most importantly, we will see the what is the actually mechanism of action of the vildagliptin, that how it acts. So let's start it one by one. Vildagliptin, it is a type of anti-diabetic drug which decrease the glucose level and maintain, and which is used for to maintain the glucose level. Inhibition, the vildagliptin, moving toward the mechanism of action. The vildagliptin act by inhibition of uh, inhibition of dipeptidyl peptidase enzyme 4 by it is done by the vildagliptin, which prevent the degradation of glucagon like peptide 1, that is GLP 1, and reduce the glycemia in patients with type 2 diabetes mellitus with low risk of the hypoglycemia and no weight gain. Vildagliptin is most high selling drug, and as it bind inhibit the action of the DPP4 enzyme. Also, vildagliptin bind covalently to the catalytic site of peptidase enzyme 4 by electrin prolonged enzyme inhibition. This raising intact GLP-1 level both after meal ingestion and the fasting state. The vildagliptin has been shown to stimulate the insulin secretion and inhibit glucose secretion in a glucose dependent manner. Uh, at hypoglycemia level, the counter regulatory glucagon response is enhanced relative to the baseline by vildagliptin. Vildagliptin also inhibits hepatic glucose production mainly through changes in the isolates hormone secretion and improve the insulin sensitivity as determined with a variety of methods. This effect underlying the improved glycemia with low risk of hypoglycemia. Vildagliptin also suppress postprandial triglyceride rich lipoprotein level for reduced TG store in non-fat tissue. A large body of knowledge on vildagliptin is regarding enzyme binding, incretion, and isolate hormone secretion and glucose and lipid metabolism too, which is metabolized, which is summarized with discussion on integrated mechanism and comparison with the DPP4 enzyme and the GLP-1 receptor where appropriate. This is all about the what is the actual the mechanism, that how the vildagliptin act, that how this vildagliptin um, uh, how the vildagliptin act and how it inhibit. Now, moving toward, as I said, that what is the is vildagliptin is best for the diabetes. As I said, it inhibit the DPP4 enzyme. They improve the glycemia control in diabetes that is not adequately controlled with other hypoglycemic agents such as metformin and sulfonylurea. So vildagliptin is one of the highest selling drug. So it is all about the mechanism of the drug. Moving toward the what is the actual what is the brand name and the generic name. So the brand name of the vildagliptin is Galvus, Jarrax, and Zilirax, and the generic name is vildagliptin. Now, it is a type of drug which act by inhibiting the DPP4 enzyme. What are the indications when vildagliptin is indicated in the type 2 diabetes? in adults. That is generally used to treat the type 2 diabetes mellitus in adult. What are the associated contraindication? Uh, uh, that is the uh, that is vomiting and nausea. What is the vildagliptin work to improve the glycemic control in type 2 diabetes mellitus by enhancing the glucose sensitivity of beta cells in pancreatic islets and promoting the glucose independence as insulin secretion. As I said about this. And then moving toward the what are the side effects and half for the adverse effect. The oral lowest published toxic dose is 0.3, and there is a fever, edema, or lipase level increase in the lipase level. And experience muscles pain. Next, the half-life of the mean elimination half-life of the following intermittent administration is approximately 2 hours. It's all about the vildagliptin. I hope you should understand what is actually vildagliptin, its side effects, use, and mechanism of action. All this thing. Here's the end of my video. Thank you.